go ahead and start on this side. Yeah? Okay, so what we're looking at here is a skate. Right now we are currently looking at the dorsal side of the skate. And we're going to look at a few things just to kind of give you a general idea. This is the rostrum up here. It's kind of bent over a little bit. You have your eyes located here and here. These are the spiracles, and the spiracles are used for respiration. So that way when they're resting on the bottom of the ocean floor, the water's going to enter in through the spiracle, over the gills, extract the oxygen, and then remove the carbon dioxide. As we move, the pectoral fins here are actually elongated, and you can see the pelvic fin located here and here. And then you have the tail, and you have some dorsal fins that are located on the back side of the tail. Okay? These structures that are extending out here indicate that this is a male. These are known as claspers. And this region right here is the pelvic fin. On top of this is the defense mechanism, and you can see all these little thorns and spikes that are all over. That's a defense mechanism for a skate, or one of the types of defense mechanisms. Alright, so now we're going to look at the ventral side. And if we're looking at the ventral side, we've removed some of the pieces to it. Again, we can notice the claspers, indicating that it's a male. This region right here is the cloaca. This is where the main body of the organs are held. This is the pericardial region, or the cardiac region, where the heart is, the gills, and then the mouth. So this is the anterior, and here's the posterior, looking at, again, the ventral side. Starting up front, or towards the anterior region, we can see these nostrils right here. This region right here is the tooth plate, and so the tooth plate, you can hear it kind of scratching there. Their teeth are a little bit different than what we would see in a shark, where they're really pointy and triangular in shape. These ones are actually used for crushing, and so they're grinding like this. So when food enters in here, it goes into the esophagus, and you can see where my finger is extending in. And right down here is where the esophagus is underneath, where I'm pointing to. And there's more grinding that goes down in there before it leads to the stomach. So the food enters in through the mouth, goes to the esophagus, and then into the stomach. So as we're moving back this direction, we're going to look at a couple other things. We have the gill filaments that you can see right here. And then these are the external gill slits that are located here. And then you have gill rakers that are located down at the bottom. In this particular case, we've got this heart area. This region right here is the ventricle. These are the auricles, or atriums. This right here is part of the ventral aorta coming off of the heart. The region right here, these extensions off of the ventral aorta, are going to be the afferent brachial arteries, just as you've seen in the shark. And for simplicity, we just noted this as the ventral aorta, but there is the conosynosis, which would be right there. Right here is the transverse septum, which is dividing the two cavities, the thoracic cavity right here, and then the pericardial cavity right here, or the cardiac region. This structure is the liver. You have the right, the medial, and the left liver. And in the center of those, you have the gallbladder, which is located right here. Underneath the gallbladder, we have a whole bunch of other organs that we're going to look at. So first off, we're going to look at the stomach, that J-shaped stomach right here. Inside of the J-shaped stomach, you have the rugae, which is used to expand the stomach itself for food digestion. This right here is the spleen. This right here is the duodenum, so it goes the stomach to the duodenum, then the duodenum to the ileum, and this is the pancreas. Inside of the ileum, there are still those spiral valves, so you can see the extra lines of tissue that are going there, and they increase the surface area. If we move this over, we can see the rectal gland right here. I'm going to pick up the ileum, and I'm going to expose this structure, and this structure right here is part of the gonads, and we said again that this was a male. If this is a female, this would be the ovaries. The gonads are going to attach up here, and this would be the vas deferens running down so that the sperm can exit the cloaca, or I'm sorry, the sperm will exit the claspers. Just to show that they are symmetrical, you can see that there's a gonad on the other side, and it also has the vas deferens that runs down here. If we get really close to this area, I've removed some of the tissue over top of this structure right here, and this is the kidney of these organisms. So the other part we need to look at right here, of course, is the different blood vessels and the spinal cord. So the spinal cord would be the top hole. The notochord, or vertebral column, which is cartilaginous in this case, is the middle hole. And the bottom hole would be the dorsal aorta for blood movement throughout the body. And that's it.